And we're going to go ahead and open up a public hearing on House Bill 3761A. And Ms. Garcia-Rivas, could you please give us a summary of this bill?
Yeah, Chair Patterson, Vice Chair Hayden, and member of the committee. House Bill 3761A requires our therapists who obtain licensure through the Health Licensing Office, HLO, to complete 2 years of supervised mental health practice. This enables HLO to issue provisional licenses to our therapists who meet certain criteria before they have completed the supervised mental health practice, and requires the Oregon Health Authority and coordinated care organizations to reimburse our therapists licensed through the HLO for behavioral health services provided to Oregon Health Plan members. This bill also specifies that a licensed art therapist or those covered under this licensure may need to be familiar with a diagnostic tool only when the provider has relevant formal training.
Thank you so much. And we have Senator Jama and Representative Tran and Dr. Andrews here to speak to this bill. Good afternoon. Is Dr. Andrews here?
Hi, I don't see them.
Go first? Okay.
Representative Tran, do you know if Dr. Andrews is going to be here?
One more time?
Do you know if Dr. Andrews, oh, there you are. Yes, good afternoon. Welcome, please. Yes, thank you. Go ahead, sorry.
Should I go first? Yes, please. Okay. Thank you, Chair Patterson, Vice Chair Hayden, and members of the committee. For the record, my name is Tran. I am State Representative of House District 45, Northeast and Southeast Portland. I'm here today to introduce House Bill 3761, a bill designed to expand access to mental health care through art therapy. Art therapy is an essential and innovative mental health practice that combines creativity with therapeutic interventions to effectively address emotional and psychological challenges. As mental health needs continue to rise, expanding these accessible and innovative services is critical for the well-being of all Oregonians. The bill ensures that licensed, certified art therapists can be reimbursed through Medicaid. Currently, these professionals are not able to bill Medicaid, which limits access to care, particularly for low-income and underserved individuals. Authorizing Medicaid reimbursement, House Bill 3761 reduces disparities, enhances continuity of care, and addresses the rising mental health needs across our state. Furthermore, House Bill 3761 streamlines administrative requirements, allowing service delivery to be more efficient. By reducing barriers, we benefit not only those in need of therapy, but also the broader healthcare system. Colleagues, expanding innovative mental health services is vital to the well-being of our communities. I respectfully urge your aye vote on House Bill 3761.
Thank you very much. Good afternoon.
Good afternoon, Chair Patterson, Vice Chair Hayden, members of the committee. For the record, my name is Senator Casey Jama. I represent District 24, which is out of East Portland and North Clackamas County. I'm here today to speak in support of HB 3761, which will reduce barriers to practice for art therapists. Art therapy is an important form of mental health and that engages creativity to help people heal. I can tell you that I have worked with a lot of immigrant refugee community members, and particularly my early career with particularly kids who are attending elementary and middle schools who are coming from refugee background. I tell you that working with those kids, sometimes they have challenges and not able to tell their teachers and their counselors what they are facing and their experience in war-torn of the country that I am from, Somalia. We were able to connect with them, art therapists, those kids who are struggling, and they were able to draw what's happening in their minds and clearly communicating the trauma that they experience in the war-torn country that they're from. So art therapy works. Currently, art therapists cannot not bill their services through Medicaid, meaning that they cannot practice on Oregonians, and the Oregonians cannot access their services. This bill aligns Oregon with other states that recognize the art therapists as qualified mental health providers. Colleagues, we are all aware that our state has behavioral health care crisis. Mental health is not a one-size-fits-all approach, and art therapy fills an important gap existing in the mental health care services. This bill will expand the availability and the variety of mental health care in our state and allow more qualified professionals to practice. I urge you strong support for this bill. Thank you so much.
Thank you very much. And I know you both have to leave for other committees. Are there any questions before we call Dr.? And thank you so much, Dr. Andrews. Good afternoon.
Good afternoon, Chair Patterson, Vice Chair Hayden, and other members of the committee. Thank you for the opportunity to speak. My name is Dr. Mary Andrus. I'm a board-certified art therapist, licensed professional counselor, licensed credentialed art therapist. I have a doctorate in art therapy, and I'm an educator with over 25 years of experience in the field. I urge you to support House Bill 3761, which addresses two critical issues to improve access to mental health care here in Oregon. First, to direct the Oregon Health Authority to list licensed certified art therapists who are licensed by the Oregon Health Licensing Office as providers who can bill master's degree mental health codes. Second, it establishes a provisional licensed art therapist status under Oregon's existing art therapy license, which brings the license fully in line with other comparable mental health licenses in Oregon, such as the registered associate status for licensed professional counselors, the licensed marriage and family therapists, the clinical social work associate, and the licensed clinical social workers. Art therapists are already providing mental health services across Oregon, but to do so, they must maintain secondary licenses, such as the LPC or the LCSW. This creates a redundancy that drives up administrative costs and adds confusion across multiple licensing boards. It also makes it harder for new graduates to enter the workforce, especially those who are from underserved or marginalized backgrounds. So House Bill 3761 reduces these barriers by aligning our licensure and reimbursement systems with best practices. This bill preserves high standards. It ensures that provisional licensees receive 2 full years of supervised practice before advancing, and it maintains the requirement that fully licensed art therapists must pass a board certification exam. In 2019, this body passed HB 2432 to create a dedicated art therapy license. House Bill 3761 builds on that foundation. It strengthens Oregon's mental health workforce without increasing costs to the state. It allows art therapists to continue more fully and efficiently to offer care to the communities that they serve, especially children, veterans, and trauma survivors. I urge you to support this bill, and thank you for recognizing the vital role that art therapy plays in Oregon's mental health system.
Thank you very much. Are there questions? Oh, I have a couple of questions,
Sure.
if that's okay. One of my questions is, are they able to bill commercial insurance now? And not at all, not,
In Oregon, no.
okay. And then what, the board certification, is that national or is that state?
It's a national certification through the Art Therapy Credentials Board.
I see, okay, thank you. Are there any other questions? Hearing none. Thank you so much for bringing this bill, and thank you for it just struck me, in medicine, you wouldn't have everybody have a CAT scan. You need different tools for different situations, and so thank you for explaining the importance of this. Thank you.
Thank you.
Thank you very much. We're going to go ahead and, I don't believe anyone else has signed up to testify on 3761. Then we will close the public hearing on House Bill 3761A, and I'd like